everybody. My name is Kaushik, and all of y'all can keep your videos off if you like, because I decided that this is a topic where not many people want to talk, or not many people have the courage to be able to ask the questions that they want to ask. And hence I decided to keep it an open forum. Rashmi had warned me that not many questions might come. And as far as I'm concerned, if there are questions, you can mask your IDs and ask. You can close your videos and ask. I'm perfectly okay with that. And if you people would like to have a separate session for those who do have this problem, well, we can coordinate with Rashmi. So this is the background by which I would like to start. There are 2 points that I'd like to bring out. All of y'all know that scleroderma is predominantly a disease of women. And I don't know how many men are on this scleroderma group, whereas it can affect men too, right? And the disease can be very severe in men as well. So the reason why I brought this up is because when we talk about sexual dysfunction, you might have dysfunction on both sides. And now to break that down, we will talk about the women first, obviously, and post which we'll talk about the men as well. So let's talk about the women first. So as far as scleroderma is concerned, all of y'all here are patients. Some of you have experienced the various manifestations of scleroderma. I don't know all of y'all, but I'd love to at some point in time. And the what I would like to bring about here is the fact that I don't know why this topic doesn't get addressed during a clinic consultation. I do not know why a woman would feel shy, or a man would feel shy for that matter, in discussing it. And I don't know why a doctor would not discuss it, because this is a medical issue which needs to be solved. Sexual dysfunction is going to affect your quality of life in multiple ways. And there's no harm in discussing it. It's part of the illness and is something that you must get addressed. So we'll talk about the various things that happen. Scleroderma, to start with, causes tightness. All of y'all have experienced that. So let's talk about the skin tightness. The way you get facial tightness, body tightness, you will get tightness in the private parts as well. So what will happen is that there will be vaginal tightness. There would be very, very tight skin around the groin, which does not allow adequate, sexual exposure. And you're not able to indulge in something which is a natural process of life in the life of a man and a woman. Now, the other thing that can go wrong is that scleroderma causes excessive dryness. It'll cause dryness of the face. Similarly, it'll cause dryness of the hands, the trunk, and it causes dryness of the private parts. What happens is, because there is skin tightness, because there's fibrosis in the skin, the sweat glands and the oil secreting glands get constricted. They dry up. They are not allowed to secrete the lubrication. And so you'll end up getting excessive dryness. So on one hand, you have tightness, on the other hand, you have dryness. And both of them can be a terrible combination. So what happens is that if you were to indulge in a sexual act, in intercourse, what happens is that you would land up either hurting yourself, or it can be excessively painful if the skin or if the vaginal wall has become very, very tight. Now, when that happens, it's going to hurt. It's going to be painful. So naturally, there is a fear, there is an aversion to indulging in any kind of sexual activity, not because you don't want to, but because you know that it's going to cause you pain. It can cause injury, you can have bleeding, you can have a lot of tear of the skin and so on, and that can be very, very hurtful. That's one part of it. The other part of it is the dryness per se. And so even the partner can get hurt and scratched. And so in the process, what happens is that both parties are now averse. This will land up obviously having consequences on the relationships. It will also have a lot of psychological impact. It is going to cause, shall I say, in a very mild way, depression. Now, what do you do about that? So this is one aspect that you want to talk about. The other part that you want to talk about is the contractures. So scleroderma causes tightness of the skin. It also causes tightness of the muscles. It causes tightness of the tendons. And so the knees don't completely straighten out. Neither the feet might have, you might even have arthritis of the knees and the ankle. So scleroderma can also have arthritis, right? You can get a scleroderma overlap, or you can get it as a scleroderma affecting the joints per se. So you have one more challenge here to deal with. And then, as Dr. Rath was talking about the scleroderma myositis, he touched upon it. I don't know whether everybody grasped it, because nobody seemed to be asking questions. Either you guys understood it beautifully or you didn't want to ask. But I will address that. He spoke about an antibody called the PMSCL. Now, the PMSCL, what does it mean? It means polymyositis scleroderma. Now, here what happens is scleroderma can be associated with other diseases as well. So scleroderma can have muscle weakness and inflammation in the muscles. Inflammation in the muscles is called myositis. And so now you have weak thigh muscles, you have weak pelvic muscles, you do not have the energy levels, you already have breathing difficulty in a large number of patients. You tend to get tired easily. Your lung function is low, so you tend to get breathless easily. And so there can be anything right from blood pressure changes to giddiness to blacking out sensation. So that's another fear, isn't it? Because it's a traumatic experience to go through any of that. And then you have this myositis, where you're just not able to sustain the level of energy because the muscles are very weak. Now, how are you going to address all these aspects? This is one part. Talk about Sjogren syndrome. I think a few of you, at least, if not all, my guess is the majority would have some amount of dryness of the mouth as well, and dryness in the eyes. Now, this is a secondary Sjogren syndrome that happens because of scleroderma. So just the way you have dry skin, you have dry eyes, you have dry mouth, you have dry private parts, and that is going to not allow you. So how do you kiss your partner when your mouth is completely dry like parchment paper? You have carious teeth, you have teeth falling out, and you possibly also have reflux. So when you want to kiss somebody, imagine acid coming out. Now, this is horrendous. Now, when you talk about all these and just imagine your partner's plight, right? So I have not even spoken about the partner yet. I haven't spoken, I'm not talking about the scleroderma male, I'm talking about the partner of the scleroderma female. So now this gentleman is wondering how to indulge in what is otherwise a normal human activity. Completely normal, isn't it? And now this man is wondering, how does he kiss his wife or his girlfriend, whatever? How does he cope up with the reflux? How does he cope up with what if she gets breathless? What if she gets hurt? And so he is also going to be reluctant. He is going to curb his desires as well. Now, this once again will land up in a rebound, because if he's reluctant because he doesn't want to hurt you, have you understood that part? Have you realized that he is possibly just worried about not hurting you? But there might be a deep down thought process to say that it is possible that he doesn't like me anymore. I'm not attractive anymore. I have changed. And so all these thoughts start creeping up, and they're very natural. What is going to happen is it's going to affect the relationship in a large way, because now what you have triggered off is a negative thought process which may or may not be genuine. And finally, let's talk about the men who actually do become depressed or do become averse, because now they look at life differently, and they look at a life of only responsibilities, no joy, no pleasure, and no physical activity in terms of interpersonal relationships. So you're going to talk about a man who is either deeply concerned and yet you're depressed, or you're going to talk about a man who's now irritated and frustrated and critical. And so you're going to face that angst as well. And you need to cope with both. So the first and foremost thing that I would like to talk, and then we'll talk about the men with scleroderma later, because honestly, though am, I have been in contact with Rashmi and Neetu for quite some time now, I really don't know how many men are there on the scleroderma group. So let's address the women's issues first. So one of the things that you would like to consider is, let's address the dryness parts first, and then we'll talk about the tightening of the private parts, and then we'll talk about the other coping mechanisms like muscle weakness or arthritis and so on. So talking about the dryness, very simple thing is that lubricants can be used. They got to be used at least half an hour to 45 minutes before the planned activity. Now, see the irritation here as well. You lose the spontaneity of the relationship, isn't it? It's not that you can straight away indulge in something because you're aroused now. This becomes a planned activity. But that's the little adjustment that is required. And if there is some kind of discussion or planning in advance, then well, just before the planned activity, you could actually, just before having the intercourse, if you have some advance notice, then not doesn't always work, and life is not always planned, but what happens is that you can apply the lubrication. You get anesthetic agent containing lubrication. So you will not have pain, and as well as the fact that you or your partner will not get hurt during the sexual intercourse activity. So this is one part that you might want to keep in mind. These are available and these can be applied, and they are safe. They're safe for the skin. They're non-allergenic. And so this could work. For that matter, any decent lubrication would work, but you get specific lubricants which don't have any kind of perfumes or any kind of chemicals which can cause a reaction. So you could use those a little in advance. This is one. The second thing that you could talk about is, what about the reflux? And I'm sure most people, not most, everyone with scleroderma is on some antacid or the other. But if you're on a single dose, you might do well to take an evening dose as well if you're on a single morning dose. Ideally, scleroderma patients, I don't think it is my ask to talk about this, so I will not indulge unless I'm asked specific questions. I won't go into some other speaker's territory. However, for now, let us understand that the reflux can be dealt with, and the reflux could be dealt with an evening dose of an antacid. Once again, you plan it so that you've taken it about an hour in advance. And if you have done that, then chances of reflux are less. The breathlessness really is purely individual because it all depends on what is your lung function. But it might make more sense to be able to be the passive partner and let yourself be loved rather than you indulging in anything aggressive, which might land up causing more breathlessness. And this can be discussed and planned. So you could plan uh, the sexual postures in such a way that you don't have too much of breathlessness, you're not landing up getting compressed at the same time. So usually the man over and the woman under might cause some amount of compression of the abdomen and the chest, and maybe you might want to avoid that position. Similarly, if you want to talk about the fact that what if the activity is planned with you being slightly light on the stomach, because again, once again, Rat spoke about the fact that you can have reflux very often. So if you are on a heavy stomach, you are likely to aspirate, you're likely to have acid coming up into the throat, you are likely to land up having breathlessness because of aspiration. And that's because the food pipe, the esophagus as we call it, the food pipe is dilated. There's reflux of acid, which is happening all the while. So I'm sure that every consultant on this panel for sure, but any rheumatologist across the country and across the globe for that matter, would be advising you about the fact that when you are uh, when you are having your meals, time your meals in such a way that there's at least a 3 to 3.5 hour gap between your sleep and your food. So you need to have your meal at least 3.5 hours before your sleep time. So this is one part of it. But the additional part, which possibly uh, also needs to be addressed, is indulge in relatively dry foods in the evening. You don't want to have gravy rich foods. You don't want to have dals and so on, which will easily reflux. So you might want to stick to a roti sabji, or you don't want to do the dals and the kadis and so on and so forth. You definitely don't want to do anything which is, even if you love it, you don't want to do anything with the spices to be taken in the evening. Now, this rule applies to every scleroderma patient. They also say that you need to be lying down in a propped up position. So you need to use more than 2 pillows to be able to not allow the acid to creep up. If you follow these two rules, you're fairly okay. Now, if you have a planned sexual activity, like I know it sounds very mechanical. Trust me, I completely understand what it sounds like. But if you have set up some kind of a schedule and you know that today evening you are relatively free from work, or your husband is going to come home, or your good boyfriend for that matter is going to come home on time, and today there is a possibility, then you might want to eat a smaller meal, a drier meal, so that you don't reflux. Now, similarly, caries teeth uh, is something which can sometimes, because of a dry mouth, you can have a foul odor, and there are specific pastes available to address that. You have to make sure, I mean, I think Kirtida is also on this group, and it's always a pleasure to have her around. She would be able to address that, because currently it is not my ask to talk about Sjogren's syndrome, but more on scleroderma. And so if you consider the fact that you get non-sugary pastes and non-sweet pastes, which would avoid the dental caries. So what applies to Sjogren's also applies to scleroderma, because you do land up anyway having reflux of acid, which is an additional complication that you're dealing with. And on top of that, you also land up having dryness in the mouth. And so it's heartbreaking for you if you had to have a reflux bout when you're kissing your partner. And so you might want to consider these. There are artificial salivas available. I regularly prescribe them to my Sjogren's patients, and it was, when I was just reviewing whether I will be covering all these points, I just wanted to be sure that I don't forget any point to talk about, because otherwise this is a very sensitive topic that women do not talk about. And so when Rashmi asked me, I said, I'm happy to talk about anything, because this is a human, very, very human, habit, and it's the law of nature. It's also the only mode of procreation. And so you can't turn around and not address this topic. And so when I was going through that, I realized my own shortcoming, that only if a scleroderma patient has asked me about dryness of mouth do I land up prescribing an artificial saliva. And thanks to this little review that I was looking at, I realized that, just the way the women don't ask a lot of, I mean, nobody asks about sex at all. But otherwise, just the way they don't ask about sex, I don't think they might want to talk about the dryness of the mouth, because they would, unless it's really hindering their chewing food or their drinking water or so on, their frequent need to drink water. If something like that happens, then they will ask you. But I don't think that they will approach the topic if they've realized that they find it difficult to kiss their partner. So this is one part that needs to be addressed, the dryness. Now let's talk about the tightness. Now, there are occupational therapists. There are, you may not know this, but speech therapists in conjunction with occupational therapists and even some physiotherapists who actually are more in the uh, field of rehabilitation. They do help you with mouth stretching exercises, because what happens is you're not able to open your mouth. So if you're not able to open your mouth, how do you kiss your partner? And so what happens is that you need, even for that matter, forget the oral sex or the kissing part of it. Let's just talk about dentistry. Let's talk about the fact that Mona just spoke about her teeth and her teeth falling off. And so just imagine that there would be other women who have these dental issues, and how do they open their mouth? Now, if they don't open their mouth, how does the dentist actually repair what is damaged, put in a new implant, do surgery? It's very difficult. And in fact, for a particular patient, I was finding out as to what is the mode out. And I realized that you need to work on this very early on, because once the mouth is very, very tight, the only way that the dentist can work on you is if you take the help of an oral surgeon who would actually make small incisions on the inside of your cheek, and very, very planned and very small incisions. And after that, finish the entire dental procedure in one single sitting, because the fibrosis in the mouth will once again heal. There will be more fibrosis again, and then the mouth is going to be tight again. Now, when that happens, you have a challenge once again. So this is, you need to work on multiple teeth. And usually in a person who doesn't have scleroderma, the dentist very conveniently calls you in multiple settings, making it very convenient for you, because otherwise, if you have to be in one sitting, and if you have to do multiple sessions, which can be 2 to 3 hours with your mouth open, it's very, very difficult even for a normal person. So imagine talking about a scleroderma. And so in a scleroderma, you might want to admit the patient and give them anesthesia, and then do this entire process under anesthesia in a single sitting. And then after a month or so, after you've repaired all the teeth, if you want to do some implants, follow a similar process and do everything in one sitting and finish it off. Now, when I was looking at all of that, it struck me, when I was reviewing as that I should kind of consider covering this point, I realized that imagine if a woman is kissing. But the difference is that the dentist requires your mouth to be very, very widely open, which is not the case here. And this is a regular need. So it's a human need. And so what you need to do is you need to approach your a speech therapist in combination with an occupational therapist who would help you with stretching exercises of the cheeks. You use your fingers, you use certain soft balls, you use marbles, which you keep between your gums and your cheeks, and you learn to speak. And you continue to do that and keep increasing the amount of time that you keep those marbles in your mouth. So it could start with just 3 minutes, 4 minutes, and you could extend it to 10 minutes, maybe twice or thrice in a day. And that would kind of stretch the cheek muscles out. It will eventually help you in dental procedures as well. So this is something that needs to be kept in mind, and this is an ongoing process, just like everything else in scleroderma. Yeah, just the way you need to look at modifying your eating habits, your sleeping habits, your food habits. Similarly, you need to modify, along with other exercises, you need to do oral exercises regularly. There are also certain exercises which are done for vaginal stretching. You can land up getting what is called lichen sclerosis. Just like people might have heard of lichen planus, if not lichen sclerosis. And the lichen sclerosis is essentially areas of big blobs of tightening in various, areas around the private parts, around the vaginal walls, around the rectal area, and so on. And so, what happens is that those cause additional tightness there. Now, that can be surgically cut open, but once again, it will heal with excessive fibrosis. So when you do a minor surgery with a plastic surgeon, you need to thereafter make sure that that surgically incised part doesn't heal in the same way. This is one. You have sex toys available, which can be used for vaginal stretching. Make sure that you don't get too aggressive. It's a slow process, and you need to use a lot of lubrication. If there is, if you're going to, if you need this help, then you need to look at that. The clitoris can sometimes be extremely tight and dry, and so it's painful even if you stimulate the clitoris, and you need to desensitize it. You need to indulge in anesthetic gels along with massages for you to be able to gently make it a little softer. Till then, you need to forewarn your partner that foreplay might be painful. Now, this is one part which you need to understand. Apart from that, we talk about the myositis. And so in myositis, you might want to consider the fact that since the muscles are weak, the thrust may not be as forceful, and you might have a lot of muscle aches and pains thereafter. And so you need to be able to indulge in positions either on chairs or stools or even with pillows, so that you are not hurting your muscles and you are not tearing private part skin, because then the healing is a nightmare. And when you already have dry skins, if you get cut on it, it burns. And so you need to be very, very careful. It's a slow process like everything else. I just said that, and I'm repeating it for emphasis, that go slow, go very gentle. You need to talk to your partner for his support, and that support works in both directions. The support could be even with the excessively concerned and fearful partner. So your fearful husband or boyfriend might be worried about hurting you, but in the process, he's hurting you right up there in the brain. And you need to make him understand that you need to feel wanted. And if you need to feel wanted, then this excessive indulgence is in fact harming your brain and your self-esteem. You need to be able to have a straight conversation. Then you need to come up with a planned schedule. You need to modify your diet. You need to plan sexual positions. You might need to consider what hurts you and what doesn't hurt you. And of course, I spoke about the anesthetic and the lubricant gels and the dilatation and so on. So this is one part of the. Now, what about the excessively irritable or the excessively critical ones who are expressing their frustrations? That is a sure downhill road as far as a relationship is concerned. And that's a sure downhill road as far as your depression is concerned. And I think it might make more sense for you to then have both parties, your treating rheumatologist and your a psychologist on board for the interpersonal conflict resolution. Because if you don't do that, then you are heading for disastrous consequences like separation and so on. It's just not worth it. Or it might be disastrous consequences as far as you're concerned. And I have had to deal with that very, very recently with a brand new scleroderma patient who actually came referred by the hematologist because the patient heard about the fact that my hospital does stem cell transplants and bone marrow transplants. So because she had Googled it and she was a lab technician herself, she went to the hematologist and the hematologist looked at her and said, look, you haven't even been treated for scleroderma properly. I think you need to go upstairs. My office is on the fifth floor of my building. So and the hematologist is on the ground floor. So he actually said, you need to go upstairs, take 5 floors, go up. And he called me up. And what I landed up getting into was the frustrations between husband and wife. So we were talking about a bone marrow and a stem cell transplant. And we landed up talking about why the girl has not even been treated despite 6 years of illness. And it comes about that the husband, who himself is a male nurse, by the way, I thought you guys should know this for emphasis, that the girl is a lab technician and the guy is a nurse. And there was these interpersonal conflicts because there's pressure, there's societal pressure about why they haven't had children yet, why her facial appearance has changed, etc., etc. And so I landed up counseling on something which I had least expected. Now, this does happen sometimes, but otherwise, this can be a planned conversation. And if you have sounded your rheumatologist in advance, then maybe he will schedule your appointment in such a way that he's a little more free to help you sort your partner. Because, Dr. Dharmanan spoke about the fact that the number of rheumatologists are few in the city. Most of them are stressed for time. And it gets difficult to kind of counsel a patient on interpersonal relationships rather than medication. There's enough counseling to be done about the medicines, the medicine side effects, the blood tests required, the interpretation of the CT scan, the lung function, the 6-minute walk test, possible need for a right heart catheterization, which is an angiography directed towards the pulmonary vessels, towards the lung blood vessels. And there's so much to be discussed in a scleroderma patient. Frankly, my scleroderma OPD is on a separate day altogether. So because I know it can take between 45 minutes to an hour for each scleroderma patient. And so I've just scheduled it in such a way that there are no other patients expressing irritation. Every patient around is a scleroderma, and so they all understand that it's going to be time consuming. And that makes life easy, and it kind of creates a mini support group within the department itself. So it's very difficult for others to be able to do all of this. Not everybody, people have practical constraints as well, and patients haven't announced in advance that they're taking an appointment and there are scleroderma. It's least expected, and the doctor suddenly sees your name on the list, and then he doesn't know what to do. So it might make more sense, because this does require to be discussed. It is an important aspect. I can't stress that enough, because it's going to spoil a lot of other things. It's going to have repercussions on your health. Depression will worsen your other organ systems because of the acid reflux. The constant stress will end up causing sleep issues, fatigue, and then fibromyalgia. So you want to get this topic addressed. You might want to take the help of a psychologist if you're going down south as far as your relationship is concerned. So this is the female scleroderma part of it. And then let's talk about the male part of it. Rashmi, how much time do I have?
Yes, Neetu, please go ahead.
No, please.
Yeah. So as far as male scleroderma is concerned, much smaller numbers compared to women, but a very aggressive disease, and men will end up at some stage in their disease with an erectile dysfunction. So this is something that you need to understand, that a man with scleroderma gets totally frustrated just the way a woman gets frustrated. Maybe a woman is, I've always had the highest respect for the female gender, more than men. I'm a man and I'm telling you this. So the fact is, women are wonderfully tolerant for a lot of crap that happens in life. Men are not. And so men are made differently, and they land up expressing their frustrations much faster, much earlier. And I have two sclerodermas, uh, male patients, and both of them have erectile dysfunction, and both of them have been completely honest about it. And like they said, I need this to be addressed. So the very first time, if their wife is sitting or their friend is sitting, they'll say, Doc, can I talk to you privately? And they take me out in the lobby. And I find that very funny because they want to talk to me in the lobby where another 15 people would hear it. But otherwise, they want to talk to me separately. And once I've said there's nothing to be ashamed about, come in and we'll talk about it. If the person is your wife, and if it is the wife, then I say that, look, she has every right to understand what's going on with you, because she's an equal partner at stake, isn't it? So when you have a problem, she herself has a problem. And so until she understands you, she's going to think that you are having an affair somewhere. And both those men laughed and told me that who's going to have an affair with us in this state? So this is how it happens. And what happens in scleroderma men is that the blood circulation to the penis is, obviously all blood circulation happens through the arteries. And you have already experienced scleroderma, all of you all. So you need to understand that the skin is very tight, the underlying tissue is very tight. But what you need to remember, and Rath spoke about this as well, is the fact that the blood vessels become narrow. And now the blood vessels in the penis also become narrow, just the way they become narrow in the fingers, just the way they become tight in the lungs. And so you are going to have very, very tight arteries which are constricted. So the blood flow, the arteries have got thickened walls, and arteries are supposed to be elastic, but they have lost their elasticity. So now you have narrow arteries which do not expand to accommodate more blood flow. And the reverse, why does a man get an erection? A man gets an erection because there's increased blood flow through the arteries. And during that time, by nature's methods, the blood does not flow out through the veins. All of you all would know this, that the arteries carry the pure blood and the veins carry the impure blood. And so the pure blood comes from the heart to the whole body, and the impure blood comes from the veins into the heart. From the heart, it goes to the lungs. In the lungs, it gets purified, and thereafter you have fresh blood coming back into the heart to flow through the arteries. Same logic in the penis, nothing different. You have arteries which carry the blood inside. When you have a lot of blood flow into the penis, the man gets an erection. Now, how does he continue to hold that erection? Because the veins become narrow. So the arteries are flowing blood into the penis, but the veins are not allowing the blood to come out. And so the man gets an erection. Now, this usually is associated with sexual desire. At that point in time, the man is, excited, and that's when this happens. Now, the arteries are not taking the blood flow into the penis now. So the penis remains flaccid. This is one part. Remember one thing, in addition to that, there's a lot of fibrosis, just the way there's skin fibrosis in your hands, in your face, on your chest, in your trunk, there's skin fibrosis and underlying tissue fibrosis in the penis. Now, what happens is when blood flows into a normal penis, the penis expands because the muscles are elastic over there. But now it doesn't happen. And so you have a flaccid penis which cannot work. And that is how the man is frustrated, the woman is frustrated, and the woman thinks that there's something wrong with the man, he is avoiding me, and the man is wondering as to how to tell his wife that there's nothing wrong with her, he's not angry with her, he's short-tempered because of his disease, and he's short-tempered because he cannot satisfy her. And now how is he going to express that to her? So this is an entire rigmarole, it's human nature, and unless it's discussed, you're not going to be able to solve it. And so what I would like to really address is the fact that how are you going to take care of this? The options, one of the drugs which is used for pulmonary arterial hypertension and for Raynaud's, which is called Sildenafil, which became notorious as Viagra, till people realized that you can't make this a notorious drug because it is erectile dysfunction is a normal health problem. Thereafter, they realized that, boss, forget being notorious. This is a life-saving drug for scleroderma patients. And so the entire impression of sildenafil changed. And then, of course, you have the tadalafil. These are the two available in India, but you also have the avanafil and so on. Now, what do these drugs do? Just the way they dilate the lung vessels, similarly, they dilate the vessels in the penis. And so there is, if it works, then great. And I'll tell you why this happens. Why do they dilate it? Because just the way the lung arteries and the lung veins, they have nitrous oxide. And you may not know this, but nitrous oxide is a chemical which dilates your blood vessels. And these drugs essentially stimulate the nitric oxide in your blood vessels, and that's how the dilatation happens. So the same thing happens even in the penile arteries, that the arteries open up, and if it is an early stage of erectile dysfunction, or if it is a moderate dysfunction, then just using these medications might do the job. And the man might achieve erection. Once again, the irritation that it has to be a planned process, just like how I spoke about in the women, because it will take 1 hour for you to act. So imagine the irritating part is already worsened by the fact that now you need to plan your sex life, and you need to plan when you're going to get close to your partner. You need to plan it by the clock. And so before that, you'll end up taking the medication maybe 1.5 hours in advance. In tadalafil, it is 4 hours, by the way. Most people don't even know that. Sildenafil is an hour and a half. And so we don't have the other drugs here, so that's no point discussing the others. But out of these two, so if you are on tadalafil already, then make sure you're taking it 4 hours before you go to sleep, so that when you come close to your partner, you don't have a problem. Now, or if it's a planned activity again, so you need to schedule it. This is one part. The other options are that you get prostaglandins, which you get them as cartridges, you get them as syringes. It's very odd. I'm sorry, friends, but I don't know why my video doesn't work, because I have no shame in discussing this topic, but unfortunately, the video is just not working. And so there is a prostaglandin cartridge, which is available like a small self-pump injection, which the man can inject into the urethra. It's a jelly kind of a substance. It's called Trimix gel, and it has a combination of a local anesthetic along with a prostaglandin and so on. So the man doesn't get pain. Again, once again, you need to take care of that, right? Now, the challenge with that is that you need to inject a small plastic. It's a very, very minute thing. Like it is as narrow as a ballpoint pen. But when you inject it, if you haven't been careful with the speed of injection, you can hurt the urethra. So it can be painful. Sometimes you can end up having irritation of the urethral walls. Sometimes there can be bleeding, and they can be that can cause burning, right? Now, when you're having sex, if some of that seeps into the woman can get burning. So this is something which has to be timed very, very correctly so that it's absorbed from the urethra and the woman doesn't face the consequences. Obviously, the man shouldn't face them at all. So he needs to be careful when he's injecting it. From the 1970s and 80s, for these intractable problems, people used to have, oh, by the way, I'm sorry, I missed the fact that the Trimix gel, similarly, the prostaglandin can also be used as a very, very small injection around the base of the penis. And it doesn't hurt. I mean, the moment you think about it, it feels gross, but you use it with a needle as thin as an insulin syringe, the way diabetics use it. And you need to do that once again, an hour and a half in advance, so about an hour in advance. And I haven't prescribed it to anybody, and honestly, I haven't found the correct urologist who would be able to do it in the city. I'm still making my team who would be interested in a disease like scleroderma. A team of specialists, colleagues is what I'm talking about. So there are enough urologists in the country, but urologists looking at these problems are few. Most of them are dealing with the kidney stones and so on, and the urethral stricture. So they can tell you how to operate the urethra, but if you have to use these things, they are not very kind of used to such patients, and such patients are very few anyway. So it's not that somebody can develop an experience on this. But you do get these injections which can be used. Most men refuse the moment you tell them that you have to put an injection around the penis. They look at you with horror. They think you're from outer space. But well, you need to tell them that these options are available, and somebody has to do the dirty job, isn't it? And then there are vacuum pumps available, and there are prostheses. So a vacuum pump is essentially exactly what it says. It's like a vacuum. It's like a tube. If any of y'all have played badminton, you've seen those shuttlecocks. They come in a plastic can. Or if you played tennis cricket, you will find those tennis balls in a can. So this vacuum looks like that, and it has an elastic band which is right at the open end. You need to put the penis into the cylinder, exert negative pressure from the opposite side, and a tension ring, an elastic band, slides over the penis onto the base of the penis. So now what happens is the natural process that I was talking about, where the veins do not kind of do not allow the blood to flow back, and so that's how the penis is erect. The same process is kind of the success rate for these are about 50 to 60%. And I will answer that question, madam. But apart from that, the last part is that you do get penile implants. So for men who have complete no response to anything that I spoke about, you get penile implants with stimulators inside that. It's a one-time surgery, and it's because obviously it's going to be for the rest of your life, since it's a permanent erectile dysfunction. And so that's what you use it for. And I think I have covered what the treatment options are. Somebody just asked me whether the sildenafil affects women and sexual life of women. So no, it doesn't. It only works for pulmonary hypertension in women, but it does help. And it might interest you to know that my gynecologist colleague uses scleroderma he uses sildenafil as a pessary, as a vaginal pessary, to cause vasodilatation. So if he is finding that there is threatened abortion or so on, or if there's possible labor or something, he uses sildenafil pessaries as well. So so that's obviously for the women who are already pregnant, but otherwise sildenafil doesn't help the sexual life of the women, and you need to use adequate lubrication. There's the woman's mind is triggered differently, and if you do not respect the fact that what they require is tender loving care, what they require is understanding, what they require is a few loving words before you indulge into, men are very practical, and for them sex is an activity that is a need of the hour, whereas for women sex is a sign of love. And so you need to make the woman feel loved if you want her to feel desired, and if you want to kindle her desire. And I think that should be the crux here. Everything else then falls into place as far as I'm concerned, because then you will work around ways for the sexual dysfunction. So thank you very much. I think I have given you a huge lecture. I hope I didn't sound like a sex obsessed person. I'm not. It's just that this is a practical need of life, and I thought somebody has to address it, and so I was happy to take it up. Thank you very much for listening.